I cannot see, let alone the bleeding artery of the patient on the operating room table. The power is off. The lights are out. I'm standing there in the dark in Haiti, my mind racing, trying to figure out what to do. There are several things going through my mind right now. How am I going to save this patient? I just met the other team members. The nurse I met is losing her mind. The Haitian staff have run out of the operating room screaming in Creole, fearing another aftershock. The anesthesiologist I just met is scrambling to ventilate the patient. It is one of those rare movie moments in life where time stands still. I was standing there in the dark with my thoughts. Things were happening around me, but I was there with my thoughts. My mind racing, trying to figure out how to get out of this situation. It was day one of my first mission to Haiti. It was going to be a long week. But beyond this table, beyond this moment, what did the future have in store for Haiti? And what could I do to help?
In the fall of 2011, I was working at a children's hospital in St. John's, Newfoundland. I just returned from 3 years working in Winnipeg, Manitoba, where two of my major interests had been international child health and tropical medicine. I found myself daydreaming about time that I'd spent learning and working in Kenya and Peru. In Winnipeg, the two best parts of the job were, one, seeing new Canadians in my clinic, and two, getting out of Winnipeg to go overseas to work. Never again would I be able to take a month or so to go gallivanting around the world practicing medicine. Luckily, later that day, one of my colleagues, a plastic surgeon, tapped me on the shoulder and asked if I'd ever heard of Broken Earth. He then wrote Andrew's email on a piece of paper towel and handed it to me.
Back in St. John's, my mind was still in Haiti, still trapped in that dark operating room. There had to be a better way of effectively delivering volunteer services to the people of Port-au-Prince. A way to make a sustainable change without putting volunteers through such a grueling experience. The fact that I was randomly assigned with other team members meant that we wasted a significant portion of the week figuring out people's skill sets and their personalities. Could I trust my anesthesiologist? Was the other surgeon up to speed? It was like the first few weeks of high school, everyone trying to feel everyone out. But unlike high school, we only had a week to do so. This lead-in time meant that we weren't using our time effectively on the ground. The goal became clear. We had to create a model that could have maximal medical impact while being sustainable. I spent countless hours and days talking this over with my wife, Allison, and my friend and colleague, Dr. Art Rideout, a plastic surgeon in St. John's, who had been on multiple medical missions abroad. From our experiences, we knew that in order to create a sustainable effort, we had to carefully select the team. Team dynamics and member selection would be paramount to the success of the team. Members had to be carefully selected based on a combination of skill set and personality. Neither one alone would lead to success. The best doctor or nurse in Canada may not work well with others in the new dynamic environment of Port-au-Prince. Second, we had to ensure that we brought our own equipment. We could not rely on equipment being available or working in Haiti. Finally, timing was critical. We needed to make sure that we selected an appropriate time length for people to be away from work and their loved ones. 1 week seemed like a reasonable thing to have a sustainable effort. We had to create our own special ops medical team, if you will, of medical professionals who would work together with their own equipment to provide a week's worth of care in Haiti. Still just an idea, this needed substance and commitment. We decided to embrace the hard work and risks that would be involved and make this a reality for the patients of Port-au-Prince. In July 2011, we were on the ground, Team Broken Earth, in Haiti, 27 medical professionals working together with our own equipment, our own special ops medical team.
I had heard of Broken Earth, and to be totally honest, I was kind of skeptical. I mean, as good as the team was, how much impact could one team have in just 1 week in such a catastrophic place? On the other hand, I knew that I was back in St. John's. Realistically, I wasn't going to be able to take more than a week, so I thought, why not take this opportunity? But even as we touched down on my first mission in Haiti, I was still not totally convinced that this was a sustainable model for aid delivery. However, just as we entered the gates to the hospital, and I saw Andrew and Art and some of the veteran nurses being greeted with open arms by the Haitian staff, my mind started to change. And then I was handed a newborn baby having seizures, and that was the end of my navel gazing for the rest of the week. Walking into that pediatric unit the first day was such an eye-opener. It was complete chaos. There were army cots everywhere, sometimes holding more than one patient. Ants were crawling all over all the medications, the baby formula, all over the patients. It was filthy. All the boys were dressed in pink, the girls were dressed in blue, they all seemed to have the same name. It was nuts. And they were all so sick. They all would have been in intensive care in Canada, but in Haiti, they were just on the general nursing unit. At each mission I go back to Haiti, that pediatric unit gets a little better, a little cleaner, a little more organized. They even have some real hospital beds now instead of army cots. This suggests that something is working.
For me, every time we go, there's a shocking realization that we are unable to help every patient that we see. We are unable to give them the help that we know is available in the world, the care that they know they need. Whether it's a child who will die of an infectious illness, or a teenager who will succumb to his cancer that is readily treatable in Canada, or the fact that we discharge post-operative patients to inhumane conditions and often to tents. Standing witness of the inability to provide blood products is an upsetting failure of the global relief effort for me. The fact that blood is not readily available to a city of 3.5 million people sends a message that we have either forgotten about these patients or that we have grossly misdirected our delivery of funds. Make no mistake, either way, it represents a failure for all of us. In medicine, it is difficult not to dwell on your failures. Believe it or not, it can be a challenge to remember your successes. But this team, this model, represents our best chance at success, the best shot we have at delivering healthcare and education to the people of Port-au-Prince. Knowing that we have in-house the equipment, the skill sets, and the education is extremely comforting and goes a long way towards getting the job done. Watching the team dynamic develop as we push through the despair, the disease, the poverty, and the violence is a testament to the model and to the individuals who are pushed to and beyond the professional and personal limits. As we have grown, we have had countless successes, and they continue to evolve. Whether it's a nurse who has taken her time to instruct an entire hospital in how to do CPR, or working with international companies such as Columbus Communications to create a clean water initiative project, or working with spinal care unit patients to teach them how to sew, create garments, and sell them so that they can provide for their families again. Our team is motivated by failures, but inspired by our successes.
To me, the Broken Earth experience can be broken down on two levels, micro and macro. On a micro level, you can't open your mouth when you're in the shower. Anything that touches your hands should never go in your mouth. And most importantly, the toilet paper cannot be flushed. It needs to go in a garbage can. Someone always forgets that one. As a pediatrician, I rely less on toys or equipment than my orthopedic colleague.
Your toys, we accept that.
So in Haiti, my tools are my ears, my eyes, my hands, and sometimes my stethoscope. I suppose I need a brain too, and that's where Dr. Leanne Newhook comes in. I can't discuss the experience of practicing pediatrics in Haiti without discussing my pediatric partner in crime. Leanne is an extremely busy pediatrician, researcher, and mother of 4. And honestly, I thought our chances of having her join the team were next to none. However, the week-long commitment was feasible for Leanne, her family, and her local patients. Together, we've completed 3 missions seamlessly, so seamlessly, in fact, that we've been nicknamed Thing 1 and Thing 2. Because I trust Leanne's clinical skills so much in Newfoundland, I'm so happy to have Thing 1 down in Haiti as a sounding board, a voice of reason, and most of all, a laugh. In Canada, in our current healthcare system, we're all so specialized and subspecialized that we rarely see each other doing our jobs. If I want my patient to have a certain medication, I'll write it on a chart, and the patient will get their medication somehow. If I want a second opinion on a patient, I write a little note on the chart. Another doctor gets called and comes and sees the patient and writes me a note back. It all happens somehow. But when we're confined to a small compound for 1 week with only 26 other people, we actually can't get out of each other's way. There's nowhere to hide. So we see the physiotherapists out in the courtyard trying to teach the spinal cord injured patients how to walk. We see the nurses running from patient to patient, trying to do their assessments, administer medications on time, keep patients clean, and in the case of the pediatric unit, keeping the babies from falling out of the cribs without side rails. We see other clinicians at various levels of experience, puzzling over problems, and we're all eager to help each other out, to make sure the patient has the best outcome, and to make each other's jobs a little bit easier. But that broken earth mentality doesn't stop as we exit the gate. Those downstream effects, I believe, really influence the way we see each other when we come back to work in St. John's. I think the broader understanding of everyone's role in the healthcare system makes for a much more respectful workplace overall. And let's face it, you can never know too many good plastic surgeons.
Our primary focus remains how to make the biggest impact we can on the ground in Haiti. But the challenges and the obstacles start far before we leave St. John's. Try getting 30 people to show up anywhere on time, let alone for a flight. And you have to expect that people have done their own research and done what you've asked them to do. Not expecting to hear en route, is it now too late for me to take my typhoid vaccine? And try packing 15 bags of medical supplies in your living room with your 3 kids helping all the time they're asking you not to go. We have had countless failures and mountains to climb. Failed grant applications, failed dates for trips, failed missions, illnesses of team members, and my failed ability to convince certain authorities that this is a worthwhile cause. But the obstacles and the challenges to get to Haiti are far overshadowed by our successes.
In the short term, I plan to return to Haiti with the next mission with Broken Earth. And in the longer term, we've engaged our Haitian counterparts in a research study that will hopefully give us the information we need to provide better care to the patients. So, what can a team achieve in 1 week? As it turns out, with the right people and the right equipment, you can see over 500 patients, you can save the lives of 15 or 20 children, you can fix over 10 broken femurs, you can teach basic life support to a whole hospital staff, and probably most importantly, you can provide some respite to the Haitian staff who are working at that frantic pace all year round.
Word of our team has spread across the country. Now other provinces and medical schools are sending their own teams under the umbrella of Team Broken Earth. And we have taken a more active leadership role in the hospital on the ground, helping to direct funds, develop curriculums, and develop safe practice guidelines with our Haitian family and friends, frequently speaking with them on a weekly basis.
Being a member of Team Broken Earth has definitely been one of the highlights of coming home to work. And I certainly didn't expect the increased feeling of connectedness to my local coworkers as I do since becoming a member of Broken Earth. On our last mission, something one of my Haitian colleagues said to me stuck with me. We were discussing the socio-political climate of Haiti when he said, "The thing that gives me hope for Haiti is the ability for collective changing of the mind." And in a way, I feel that Team Broken Earth has started its own collective changing of the mind for healthcare delivery in Newfoundland.
When we arrive back in St. John's, back in Canada, it's the same every time for me. I feel exhausted because it's like doing 10 weeks worth of work in one, but I'm not at all tired. I'm inspired. I'm already thinking about what's next. Of course, it goes without saying, I'm excited to see my wife and children. I hope my children will one day realize how lucky they are, how lucky we all are to have been born in Canada, to enjoy freedom, and to not have to fear the socioeconomic burden of illness. There is a sense of rejuvenation that occurs from that week of practice in Haiti as well. You hope that you can sustain that when you return to Canada in your own practice. It reminds me of the reason why I chose to do medicine in the first place. It represents a chance to practice medicine in its purest form. Pure medicine, the way it's supposed to be practiced. Colleagues eager to help one another without any egos. No headaches from red tape. It is the reason why I chose to do medicine, helping to make life-changing differences in patients' lives. Team Broken Earth gives us an opportunity to use what skills we have to make the biggest sustainable impact that we can to patients on the ground in Haiti who have so little. Thank you very much.
Thank you.